Okay, it's my pleasure to introduce this next session, which is on global implementation science and cancer control. And we have first Dr. Patti Gravitt, who is the Deputy Director for the National Cancer Institute, Center for Global Health. And she'll just start by giving a few remarks virtually. And I see there, Patti, sorry, we're running a little bit late.
No worries at all. And I'm going to just go through this. I'm happy to share my slides with any participants. So I'm going to just kind of highlight a couple of topics so that we can get back on track. So let me know if you're seeing the correct screen or not.
We are seeing your presenter view.
Okay.
Now it's good.
Oh, now you're not. Okay, let me go back. Okay, now you're seeing presenter view?
We're seeing your presenter view, so we need to see the full slide.
Oh, okay.
Perfect.
How's that?
That's good. That's good.
Okay, perfect. Perfect. Yeah, so let me just say that I just wanted to start this by saying that at the NCI Center for Global Health, we did a strategic planning process led by our director, Satish Gopal, in 2021. And in that, implementation science was developed as a global strategic priority for us. As you can see, accelerating global cancer implementation science is one of our key strategic priorities. And just to tell you that we are approaching global cancer implementation science at CGH with our core values, which I've heard multiple times today. And again, I just cannot thank Maria and colleagues enough for inviting us all to, to participate in this conference. It's been so refreshing, and I'm just so optimistic of what we can all do together. But our core values at CGH are really those of collaboration, equity, and impact. And that's one of the frames that I think I want to talk about. And I'll just say that I have no financial relationships and that these views are my own and don't necessarily represent NIH, NCI, HHS, or any other collaborator. I'm going to skip through that because I'm trying to go through these quickly so I don't take up more important time. But just to tell you that often when we talk about evidence-based interventions for cancer control, we're looking at the, at the evidence of the data. Is it for or against, implementation or consideration? Is the data strong or conditional or weak? And then, the grade evidence where we make guidelines is also really important to know that they specifically state that we make recommendations by also considering the balance of consequences or the evidence to recommendations. And that includes the quality and the balance of benefits and harms, which we do all the time, but less likely that we do pay a lot of attention to the values and preferences, particularly as we try to take evidence-based data and translate it across the globe. We don't think a lot about feasibility, equity, and acceptability, and certainly less about resource use. And that is particularly applicable in not just, I would say low and middle income countries, but in any country where we have a, plethora of resources and where we have dearth of resources in different communities. And equity is all about trying to, look at that very specifically. I'm going to just skip through these because I really want to get through and just say that one of the key features of the Global Implementation Science mission at the Center for Global Health is integrating policy, practice, and research in diverse contexts. We're really trying to embrace complexity that you've all talked about today with such great examples by thinking more about embedded implementation research, where we really work together with the implementers, policymakers, to really try to understand, what's working for whom and under what circumstances. And I'm just going to end by saying that, our typical view or frame of what research does is to take basic science and mechanistic studies together with population science and clinical observation studies that lead to some causal inference or mechanism that leads to an intervention design. We test that in clinical trials. We summarize it by systematic evidence synthesis, and that results in clinical practice guidelines. What I want to say is we're recognizing that that still leads to some major inequities in cancer control, particularly when we think about this in a global setting. And I think that what the Center for Global Health and others at NCI are trying to do is to realize there's a second frame of research process that really is going to enable equitable cancer control. And that is to question, did we implement these clinical practice guidelines? If we did, how well did they work? If we didn't, what were the barriers and facilitators to adoption and implementation? Those things are going to result in what one of my colleagues said this morning about causal inference. What was the mechanism of why it did or didn't work in different contexts? That'll lead to an implementation strategy design, which can be tested using pragmatic designs, hybrid designs, and time series designs. And we summarize that with realist evidence synthesis, which also we've talked about earlier today, and that will feed into the broader theory of why things work in certain contexts and why they don't in terms of implementation strategies, so that we can develop context adapted guidelines, again, that will really enable equitable cancer control. And I will leave you with this. Take a quick picture because this YouTube video is phenomenal. But it's just saying that it's not about doing the right thing or using the right theory, model, and framework in our view. It's really about using the right thing that's fit for purpose in your particular situation. So with that, I'm going to stop so that I don't take any more time. And really, congratulations to the organizers. This has been a great meeting and can't wait to hear more.